So with Mr. Lopez having his physical function decline, his cognitive status change recently, I think that can really be argued as just being an electrolyte imbalance and dehydration cause. And really, after reviewing his case, reviewing how he did in his previous treatment, reviewing his current symptoms, the lethargy, the dizziness, the acute confusion, hypotension, that can all be signs of dehydration and electrolyte imbalances as well. But based on his previous treatment, I've taken some notes down on some things that I might want to ask him or his caregiver if he's not able to communicate, and then some certain signs or certain tests and measures that I would want to look at or even perform on him just to ensure we're covering all bases, of course. But I believe that a lot of his symptoms and a lot of his signs that he's been experiencing, especially being so acute, lines up with electrolyte imbalance and dehydration. So I mean, with he's got his polypharmacy, so he's taken a couple different medications that might be counteracting each other or causing this lethargy, this confusion. He's on a diuretic, which can be known to be causing dehydration because of the fluid retention. So that could play a role in as well. With his age and his just an older age, you're slowly decline in your cognitive function as well. But questions I would want to ask him, I have here just, has he been eating and drinking normally? Has there been any changes with that? Or about his urine, his urine retention, or not retention, but urine output. So has he been increase urine and decrease? If it's dehydration and electrolyte imbalance, more than likely it'll be a decrease in urine output. Asking if he's been more tired or confused at home before today because it's been so acute. Like, how long has he noticed these symptoms have been around? And just if he's noticed any vomiting, diarrhea, or excessive sweating, because that could be other signs of hypoglycemia, hyponatremia, which could, again, electrolyte imbalance. Those are good signs of an electrolyte imbalance. When it comes to the PT side of it, I would want to check his vital signs, so his blood pressure, heart rate, and different positional changes as well, just to see if the volume depletion and the different positional changes has any effect on that. Checking his skin, checking his movement abilities, functional abilities, so doing the tug test with him as well, because with dehydration, electrolyte imbalance, you might notice some unstable movements, losing balance as well, so maybe even doing a balance test like the Berg, just to double check that as well. And then just some lab diagnostic testing I would want to do. I'd want to, of course, check just his basic metabolic panel. That would tell me a lot: his sodium levels, potassium levels, creatine, his glucose levels. So a lot of levels that really are big flags towards electrolyte imbalance, dehydration levels. So it'd give me a good information. And then, of course, maybe just his ECG or his EKG, just to really check his heart arrhythmias. I know his heartbeat was already regular as it is. So I'd want to double check that as well. But overall, I think a lot of his signs and symptoms that he's been experiencing really points to dehydration, electrolyte imbalance, but especially given the medications he's on, his history of diagnosis. But that can all be confirmed through certain tests and measures that we can give him.